Bore da. Oh, it's a huge pleasure to be here. I always feel so privileged to come back to Wales. My first school was Gladstone up the road, and then I went to Penabont Primary School in Bridgend, and then Bridgend Grammar School, and then Hawardian High School back here in Cardiff, and my university education was here too. So it's when I say it's a privilege, it feels a huge privilege to be here. And the question about why we're here is really important, I think, is what have we all come together for in this room? And it is, I think, about creating the conditions where all of us are able to live our mysterious, unique lives to the full. As I said, young children growing up feeling safe and loved, and a sense of wonder and magic in their lives, whether it's young people growing up also feeling motivation, excitement, a sense of promise in their lives, or as adults that we continue to feel a sense of wonder and joy in our lives. And for those who are aging, or for those who are facing death quite soon, for them to be able to die in a way where they feel as safe as they can feel and they feel as loved as they can feel. And I think that's what we're all here for in this room today. I've come to the right meeting, haven't I? Yes. Yes. And the question is, how do we achieve that? How can we best achieve that, given the challenging circumstances that we face? And I always feel that for me, what the most striking thing is about our health and social care, and indeed third sector services, is that we should really make sure that the process of the way we work mirrors the content of what we do, and that it's also about ensuring that everyone who works in these sectors also feels a sense of fulfillment and happiness and safety and support and indeed joy in the course of work. Because if the process doesn't mirror the content, then something is deeply amiss. I'm afraid to start wandering now, given what Sue said, in case I end up at the Millennium Stadium or somewhere. So it's how do we ensure the process mirrors the content? And what's really striking is, I think, that we are damaging the health and well-being of the large proportion of people who we ask to deliver health and care for others. So we know that across the UK, something like 50% more staff working in health and social care report debilitating levels of work stress compared with the general working population as a whole. That, of course, has effects on our ability to deliver high quality care. The more stressed we are, the more anxious we are, the less able we are to deliver safe, high quality care, to make good decisions, to work effectively together. It also has knock-on effects in terms of three key indicators of organizational health. Sickness absence levels are well over twice as high in the public sector as they are in the private sector, and they're highest amongst health and social care staff in any area of the public sector. It has an impact on retention of staff, so we see very high levels of quitting and intention to quit. And it has very big impacts as well, of course, on recruitment, on the attraction of people to work in these sectors. And it seems clear when we look at the current crisis in terms of workforce across health and social care across the whole of the UK. Indeed, by the way, sickness absence levels are significantly higher in Wales and Northern Ireland. When we look across health and social care in the whole of the UK, the collective impact of these circumstances constitutes a crisis in terms of workforce and the well-being of the workforce. And it raises the fundamental question of what are we to do? We have all of these targets and plans and intentions and so on, but if we don't have a healthy, effective workforce, we can't deliver that. And as the problems of recruitment and workforce mount, they increase the pressures on the staff who are still working. It's not a sustainable situation. It's not a sustainable situation. And that's the reason why I think health and social care have come together to look at principles of leadership within health and social care in Wales. It's why Project Lift has been launched in Scotland to change the whole leadership culture. It's why in Northern Ireland they have committed across health and social care to developing compassionate and collective leadership cultures. And it's why in the next few weeks in England they will publish the People Plan, focused on how we create collective, compassionate and inclusive cultures, and how we ensure that we are fulfilling the core needs of those who work in these services so they can deliver for the people of the communities that they serve. How do we do that most effectively? Well, I think now more than ever we are faced with the greatest complexity we can imagine. We are faced with a situation where, as I said, we have a workforce crisis. We're also faced with a situation where we have scales of challenges we've not had to address before. The recent floods in Wales have been particularly damaging to many people, and that is just an indicator of what's to come. And we're seeing similar climate crises around the country and indeed around the world. We're seeing a huge loss of biodiversity, and we currently have the coronavirus crisis, which I guess what we're thinking is it's likely to become an epidemic. These are enormous challenges. When we're faced, I think, with great complexity, it's really important that we step back. It's very easy, I think, and it kind of gives us a false sense of safety if we react and start doing things in a very reactive, desperate way. I think it's important to step back and to think about our health and care services and say, let's take a measured approach. And I think it's really important to step back and take a measured approach by saying, what's at the heart of all of this? What is at the core of all of this? And when we created the welfare state in 1948 with an amazingly inspired government, Clement Attlee and the amazing Aneurin Bevan, it was with a commitment by a post-war society to create a society where everyone would get care who needed it, high quality, compassionate care, regardless of their status, prestige, wealth, background, skin colour, sexuality. We wanted to be, particularly in Wales, I believe, an inclusive, compassionate society. And I told the story last week at the Swalex Stadium of my mum, who is 93 now, who was growing up in Llansamlet, and at 9 years old, suddenly her father had a massive heart attack and died. So her mother was left with 5 children, young children, all under 10 years old, and she was sent to an orphanage in Wandsworth in London, which actually was a pretty enlightened place, I have to say. And 2 of her brothers were sent to other orphanages in London. And she says at that time, for example, if they were sick, they couldn't afford to go to the GP because it cost half a crown. And that was just not, they had no income. They'd lost the house because they couldn't pay the mortgage, so they had no income. All of that changed in 1948 when we introduced the welfare state. And I think it expresses a core value of, not just of our society, but of humanity generally, that we are about compassion. And all of you and the people you work with and all of those who work in health and social care in Wales and in the voluntary sector have also made a decision to dedicate a huge part of your, I think, precious lives, your unique lives, your mysterious lives, to caring for those in your communities. So you too embody a core work value of compassion. And compassion is, I see examples of it being, I remember being told by a GP in Southwark a couple of years ago that she danced in her surgery that day with a lonely elderly man when she discovered they had a shared interest in dancing. And I saw her recently and she said he keeps coming back for more dancing lessons now. And I was telling my friend Catherine at breakfast about my in-laws and having domiciliary care workers, they're 96 and 97 and very infirm, and how it is the human connection, the touch on the shoulder, the warmth, the inquiry, the use of language, that's most important to them, not so much the bathing and the physical care. It's that compassion that they show day in, day out when they visit. It's those examples of compassion that you see every day in your lives, and I'm sure practice as well. And it has 4 core behavioral components. So, is it Hugh? Yeah. If you're in distress, then for me to be compassionate, first I have to be present with you. So I have to attend. The first component of compassion is attending and being present. And Nancy Klein uses a wonderful phrase, listening with fascination, which I think is beautiful. I was reading an article yesterday, a research article showing that when we look into each other's eyes, you know, particularly in the context of what do we do now? Do we touch? Do we hold? Do we shake hands? Do we bump hands on our head? What do we do? Actually looking deeply into each other's eyes blurs the boundaries between self and other. It blurs the boundaries between self and other. So it's about attending, and second is understanding the causes of your distress through having a dialogue with you rather than me imposing an understanding. And third is empathizing with you. Is my feeling your distress through our conversation? Because that gives me the motivation for the 4th critical element of compassion, which is the intention to help or to serve. So attending, understanding, empathizing and helping. Make sense? Yeah? And when we look at, with neuroscience now, we're able to look at what goes on in the brain when we ask people to undertake certain tasks. And when we ask people to be sympathetic and empathic in a conversation, what we see is that that's associated with the activation of pain centers in the brain. If Hugh, for example, is in pain, physical pain, then that's going to, and I empathize, I'm going to be feeling that discomfort, and of course it activates the pain centers in the brain. But when we ask people to be compassionate with the intent to help in their interactions, that's associated with the activation of pleasure centers in the brain, of pleasure centers. Why? Because all the evidence we have is that humans are hardwired to be compassionate and altruistic. It's what enables us to work together, to live together, to bind together in our small groups, in our small communities. And so when we help others, when we're altruistic, it's associated, of course, with the reward, with the pleasure centers of the brain. Indeed, the evidence we have is that we are happiest when we are helping others. That we are happiest when we're helping others. And I just want to, lest you think this is some kind of soft candle, Pilates, kind of smelly candle sort of idea, let me just show you some of the recent findings from a review of all of the work on compassion, specifically in health and social care, in healthcare particularly, showing that, and I won't go through all of this, but let me give you some examples. The first study is a randomized controlled trial of people with who have a visit from an extra visit from an anaesthetist before their surgery. And the purpose of the visit is to give special care or have a compassionate interaction. And compared with the normal preoperative treatment, those patients then subsequently require 50% less painkillers after their operation, simply from having a compassionate conversation with the anaesthetist prior. Another randomized controlled trial compared anaesthetists giving sedatives prior to the surgery rather than having compassionate interaction. And what that does is it makes patients drowsy but not calm, whereas the compassion makes patients calm but not drowsy. And what we see again is a dramatically lower requirement for opiates post-surgery, but also significantly shorter length of stay in hospital. in both of those studies. A study, a randomized controlled trial of patients with an early diagnosis of non-small cell lung cancer, which is likely to be terminal, randomly assign them to normal early cancer treatment or to early palliative care, so extra compassion. And it was designed to look at levels of anxiety, this study, but what they found was, surprisingly, that those who were assigned to the early palliative care survived on average 30% longer. What we see also in long-term illnesses like diabetes and HIV treatment is when, and these are large-scale studies, the HIV has two studies. One was of 22,000 patients in Italy with 409 physicians. When the clinicians are compassionate, that adherence to therapy, expectations about treatment outcome are much better, much lower odds of the virus in the bloodstream, and in the case of diabetes, dramatically lower odds of complications and much better optimal blood sugar control. And the other, I guess, fascinating thing, we know in the case of psychological treatments that therapist alliances and compassion and interactions are hugely important in terms of outcomes in mental health. What we see also is that more compassion although the expectation is that compassion will affect encounter length, it doesn't. One meta-analysis, combining the results from many studies, showed that there was no difference, and one study suggested there was on average about a 40-second difference between being compassionate and not being compassionate in interactions. But interestingly, these studies show that clinicians miss about 96% of opportunities to be compassionate in interactions, and about 56% of healthcare staff say they don't have time to be compassionate in their interactions. There are huge differences in cost savings because of adherence to therapies, lower levels of referrals for unnecessary treatment, lower levels of medical interventions when people just take the time to listen with fascination and to be empathic and to understand. And we also see, interestingly, how when clinicians are compassionate, that it has a dramatic effect on their anxiety and well-being and depression. So the research evidence has accumulated to show us that being compassionate has a dramatic effect on our own well-being as carers, as human beings in our interactions with others. And you can see the size of the effects is greater than the effects of aspirin in the likelihood of heart attacks, and significantly stronger than the effects of statins in the 5-year risk of a cardiovascular event. Compassion is the most powerful intervention that we know of in health and social care. And the challenge for us as leaders is, how do we create the conditions where those who we lead are able to deliver the high quality, compassionate care that they want to deliver, and that our communities want them to deliver, and that the Deputy First Minister wants them to deliver? And the answer to that question is, it's about the culture that we create. And culture, what's culture? Culture is the way we do things around here. Somebody said that a better definition is, culture is the way we do things around here when no one's looking, which is actually a really wise definition, I think. So I mentioned last week when I was at the Swalex Stadium with health and social care staff that when I was doing my PhD here in Cardiff many, many years ago, I'd run out of money towards the end of doing that PhD, and I managed to wangle a job as a labourer in Oakdale Colliery in the Sirhowy Valley, which was then the largest coal mine in South Wales. And what really struck me when I went to work there, initially I was very afraid because it's a very hostile environment, I guess, was although everybody's bonuses was dependent on productivity, the number, how many hundreds of thousands of tons went out of the coal mine each week, the core cultural value was safety. Everybody was focused on their safety and each other's safety particularly, and humour. So the culture was a culture of safety. And the truth is that every interaction by every one of us every day in our organizations shapes the culture of our organizations. Every interaction by every one of us every day shapes the culture of our organizations. How warm we are, how kind we are, how cynical we are, how irritable we are, how optimistic we are, how compassionate we are. Every interaction shapes the culture of our organizations. But the role of leaders is particularly powerful, because what leaders pay attention to, what they focus on, what they talk about, what they monitor, what they model in their behavior, tells us what it is that they value. And therefore, if we're to create cultures that are compassionate, then we have to have leaders who model compassion in their leadership. And what that means in practice is leaders who pay attention to those they lead, who listen to them with fascination. One of the complaints I hear is we only see our leaders when something goes wrong. It's leaders who understand the challenges that those they lead face. Not through imposing an understanding, but through having a dialogue, which may create conflict. But that's good. It's leaders who empathize, who feel for those they lead. What is it like to be constantly anxious that I'm going to make a mistake? What is it like day in, day out to feel that I'm overwhelmed by a workload? What is it like to feel that I'm so busy I don't feel I've got time to even get a drink or to go to the toilet? What's it like to feel when I go home at the weekend that I'm so anxious that I made a mistake that I can't sleep? So to truly empathize and then to ask the question, well, how can I help? Because see, it's interesting. These four behaviors, this is not some new model of leadership, by the way, we've just kind of, oh, here's a new model of compassionate leadership, that'll replace transformational leadership or leader-member exchange or whatever. If we look at the last 100 years of leadership research, these four behaviors come out again and again as being absolutely critical to effective leadership. The most important skill of a leader is to listen. To deeply listen with fascination. And the most important task of a leader is to help. So probably the best supported leadership theory in all of the leadership literature is what's called path-goal theory, which proposes that the function of a leader is to clear the path so that those we lead can achieve their goals. That's removing obstacles that get in the way and providing the resources and the supports which enable people to fulfill their goals in their work. So the most important task of a leader is to clear the path for people so they can achieve their goals. And gosh, what a coincidence. This matches on to the key core behaviors of compassion. Well, no, it's not a coincidence, because it is our nature as human beings. It's how we're hardwired is to be compassionate, is to help. We need to be reminded of it because it's so core to our well-being. We need to connect. Connection is core to us. You're more likely to die from loneliness than you are from the effects of obesity or diabetes. It's about equal with smoking. Connection is core. So it's not a coincidence. It's because these behaviors are core to being human. You with me? How are you doing? Still with me? So what this is not, people may say, well, compassionate leadership, that's about being nice to everybody and pleasing everybody. No, 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 no. As I said, it's not scented candles and soft cushions and Pilates and yoga. This is a really tough way of leading, because our compassion ultimately is for the people that we serve in Wales. That's our highest compassion. So, I always remember when Nelson Mandela was released from Robben Island prison back in, I think it was 92 or 93, and the ANC now had their leader. They were ready, absolutely poised to go to war with the hated apartheid regime, and also with the Inkatha Freedom Party, the Zulu people, because of the appalling bloodshed between these two groups. But Mandela went against all of his followers, virtually all of them, and said, no, we're not going to go to war. We're going to seek a path through reconciliation and negotiation. And I think against all of the odds, for those of us who remember that moment, we absolutely anticipated a huge, prolonged, awful, bloody civil war. And Mandela, and a few people around him, prevailed out of a greater compassion for their society. He was prepared to go against his followers out of a greater social compassion. Compassion is not about acceding, pleasing everybody. Compassion is vested in our care for the people of Wales, of creating that environment. And I think Wales has a wonderful opportunity to offer a model for the world of a community and a society we can create, because of our cultural history, we're small enough, we're close enough to enable that to happen. So compassion is about challenging the status quo. It's about challenging people who are abusing power. It's about challenging people who are being ruthless. It's about challenging where there are chronic performance problems, where we're not achieving what we need to achieve. That's what compassion truly is. And also compassion, I want to be clear, is about a focus also on not just individuals, but on institutions. It's about compassionate organizations. It's how we relate to each other organizationally. If our national bodies are not modeling compassion in the way that they operate, by listening to each other with fascination, by understanding the challenges that this other organization faces, a voluntary sector organization, social care organization, by empathizing with them, and then by asking the question always, how can we help you? How can we as an organization help your organization deliver for the people of Wales? So this is about institutional compassion, not just about organizational compassion. And it's also understanding that compassionate leadership is about effective leadership, because this is for the people that we serve. It's about inclusive leadership. If it's not inclusive, it's not compassionate. If it's not inclusive, it's not compassionate. And the underrepresentation of different groups at senior level in our organizations across the UK is shameful. We created the welfare state to be an inclusive, compassionate society, and yet in our own organizations we're not modeling the inclusivity which is at the core of the whole of the welfare state. And compassionate leadership is also about collective leadership, about ensuring everyone has a voice within our organizations, the voices of those who are ignored, or the voices of those who are marginalized, the voices of BAME staff in meetings, or the voices of women at senior level, or the voices of communities, the voices of the citizens that we serve. That's what collective leadership is. And it's also about compassionate leadership is about being compassionate across boundaries, as I said, of always asking the question, how can we help your organization deliver for the people of Wales? So the question is, how do we create these sorts of cultures within our organizations? And we can produce policy documents and strategy documents. It's about making it happen in practice. What we've found in our research, and many other people have found, is that there are 5 key cultural elements we need to get in place within our organizations. And the more that these 5 elements are in place in each of our organizations across Wales, the more similar our values will be and the better able we are to work with each other. Because culture is what we value. That's what culture is. It's what we value here. In Oakdale Colliery, it was safety and humour and support. It's what we truly value, not what it says on the website. And the 5 cultural elements, and I want to explain them each briefly, are these. The first is that we need in our organizations a clear shared vision of what we're here for. And every organization gets pretty good at having some words on the website, but what we know is it matters that this is translated into what leaders pay attention to and talk about and model. One of the kind of really exciting things we got to do as a research team at one point in looking at cultures across the English healthcare system was we wanted to know what senior leaders were talking about. What do they talk about? What do they talk about? And we had the board minutes from 70 NHS trusts, 71 actually, for an 18-month period of their meetings, and we analysed the content, 80,000 pages of the most exciting, exhilarating material you can possibly imagine. And we found that in many instances, what they were doing was spending far more of their time talking about financial performance and productivity and cost effectiveness than they were about the quality of care we're providing to the people that we serve. Those issues, of course, are important, but when they supersede our core purpose in the mouths of those who lead, that trickles through, we found, to the whole organization. And then people feel a discrepancy between their core values at work and those of the people they lead. It doesn't matter that we say, well, this is what we discuss behind closed doors. It leaks out and it's communicated to those we lead. So it's about having a really clear vision and set of values that is lived by leaders every day. This is what we talk about, this is what we focus on, this is what we monitor, this is what we reward, this is what we model in our own behavior, a focus on creating conditions where people growing up and living in Wales live their lives to the full, are as happy and as safe as we can possibly achieve. And second, it's translating the vision into clear priorities at every level, beginning with executive teams, beginning with the leadership teams. So what we've seen is that particularly in health and social care, there's a tendency to generate multiple priorities. We were talking about it this morning, Catherine, and Hannah, wherever you are, I've lost you. We were talking about this morning, is that the Welsh Assembly generates priorities, we get national bodies that develops priorities, our executive teams develop priorities, and we've come to call them the priority thickets, because there are so many priorities, people can't see what's important anymore. How ironic is that? And yet what we know is that what predicts team effectiveness, whether it's an executive team, a community mental health team, whatever, what predicts team effectiveness is having agreed 5 or 6 clear, challenging objectives aligned to the vision and meeting regularly to review performance. At its very simplest, that's what predicts team effectiveness, from the executive team to the frontline team. A limited number, 5 or 6, of clear, challenging objectives and meeting regularly to review. One of those objectives should always be improving the effectiveness with which we work cooperatively with the other teams, departments, organizations we need to work with. In every organization in health and social care, that has to be one of the objectives. Make sense? Yeah. And it's also then creating a feedback-rich environment so people are getting data that tell them how well they're doing. This is evidence-based practice. This is not some management ideology. It's simple. And also we know that when people are working in teams or groups or departments like that, stress levels are dramatically lower and they're much more productive and much more effective and much more innovative. And the third is the importance of creating a sense of commitment and trust and motivation amongst those we lead. How do we do that? Well, that's through effective leadership, of course, and if we look at the last 100 years of leadership literature, and on the slide presentation, which I hope, Jonathan, wherever you are, everyone will get a copy of. We reviewed all of the leadership literature, and what emerged from that was that there are 6 core behaviors that come out repeatedly, or styles. Leaders must be authentic, genuine, not putting on some mask. They must, secondly, be open and honest with people that they lead. Third is they have to have humility rather than hubris or narcissism. The humility, it's not about pleasing people, it's about the humility of asking, how can I lead you better? What do I need to do differently? What would make a difference? The humility to say, I don't know what to do. I don't know what the solution is. Let's come together and explore. It's the opposite of narcissism, which is, in the general population, it's about 1%. Among senior leaders in organizations, it's around 6%. I mentioned last week it's 100% in the current American presidency. It's about, so authenticity, openness, humility, optimism, appreciativeness, saying thank you. The Deputy First Minister said thank you this morning. You know, the most frequent complaint I hear from people in health and social care is, apart from clients, service users, patients, no one ever comes and says thank you to us. We're working so hard, we're contributing so much, and no one ever comes and says thank you. And I think it's because we know that human beings consistently underestimate the power of expressions of appreciation and gratitude on the other. We consistently underestimate that. Yet when we do that thoughtfully and appreciatively, I think as long as we do it thoughtfully and genuinely, we can do it 10 times more. And the ripples spread out. As you say thank you to one person, appreciate one person, and the ripples spread out across the organization. So there's a lovely study of in organizations where, again, it was a randomized controlled trial. Half of the people were asked to spend the next 14 days every day to do something kind for somebody else in the organization. So, and interestingly, at the end of the 14 days, looking at the mental health of people, those who were in that, as it were, experimental group, doing acts of kindness, their well-being had dramatically improved. But what was interesting was that the people that they had been kind to, or done acts of generosity to, had themselves gone out and been kind to others and done acts of generosity. And it wasn't simply reciprocating to those who had been kind to them in the first place. Our behaviors spread out across the organization. Actually, what spreads out as well is incivility and rudeness and aggression and intimidation. So those behaviors are core. And I think the other thing that's really important to understand about creating motivation and trust and commitment and well-being amongst our staff is that we have to understand what are the core needs of people at work. What are the core needs of people at work? If you were to name 3 core needs, just reflect for a minute. What do you think those 3 core needs are? And what the research evidence tells us, this is from a model called, I can't remember what the model's called actually, but anyway, it's, we've called it the ABC of core needs. It's called self-determination theory, the model. It's, and it says and the evidence is very supportive of this, people have 3 core needs at work. First, they need to have a sense of autonomy and control. So I need to feel that I'm in control. I'm not being coerced, I'm not being forced, I'm not being always pushed. I have some discretion, I have some sense of control. I feel I have voice and influence. I can influence what goes on in my workplace. I feel I can make a difference. I feel I can, that I have agency. And I feel that I operate in a just and a fair culture, that this is a place where there is justice and fairness. Because if I don't feel it's just and fair, then I don't feel I have control. And second is the importance of a sense of belonging, that I work in a team or department or group where I care for people and I feel they care for me. As I said earlier, belonging is the most fundamental need, aside from our basic biological needs, in human behavior. Belonging is hugely important in the communities that are our workplaces. And that belonging is conferred by the immediate team we're part of. It's also about working in a culture that feels like it's compassionate and supportive and inclusive. Discrimination, bullying, harassment, communicate to people, exclusion. You know, you can demonstrate children in the playground who are excluded, the effects, you know, who are not included, who are pushed out, the effects on their central nervous system are dramatic. Creating that sense of belonging in our work environments is critical. And the third is the importance of a sense of competence, that I can do my job well, that I don't go home at the end of every day feeling a sense of moral distress, that I haven't provided the care I should have, that I felt, you know, I went into this business to provide. That I go home feeling that what I'm doing is making a difference. That I'm continually learning, developing new skills so that I feel more and more competent to make a difference in this sacred mission that I have of caring for the people in my community. Those are the core needs of people at work, and our role as leaders is, when we make decisions, to ensure that we're better meeting those core needs rather than detracting from the sense of autonomy and control or belonging or competence. Because how else are we going to fulfill the ambitious targets of Welsh Government or our own visions if we're not ensuring that the people we're leading are motivated and have well-being? And these are the royal roads, if you like, to achieving that. So it's ensuring that we are providing voice and influence for all, that we're creating climates of justice and fairness. Merseycare, a mental health and community trust, 3 years ago instituted a just and fair culture. So in the course of the last 4 or 5 years, they've reduced the number of disciplinaries by 85% and grievances by over 92%, with an average saving of £2.5 million a year. But more importantly, it's transformed the culture of their organisations in terms of relationships between staff. It's about creating good working conditions for people, IT systems that work, where the passwords work, where the computers function, where people have got seats to sit on. That's about autonomy and control. It's about being able to take breaks when I need to. It's about being able to go home at weekends and not have to work all weekend or all evening. And belonging is about creating effective teamwork and compassionate leadership and inclusiveness and manageable and safe workloads. East London Foundation Trust cut out 85% of its clinical administration activities, 85%. They're rated outstanding by the Care Quality Commission in England, and they continue to reduce workloads by asking staff, what would you get rid of? What would you stop doing? And they do that on a rolling basis, and what rules staff would get rid of. And the executive team doesn't make the decision. The staff vote on the suggestions, and then the staff implement them. There are lots of examples of role shifting in different organisations in health and social care where workload is being reduced effectively. When we improve team working, for example, we reduce workload. I have had the privilege over the last 2 years of chairing an inquiry for the General Medical Council into the mental health and well-being of doctors because of the crisis among medics that we're losing so many. And in that report, which was published in November, called Caring for Doctors, Caring for Patients, we found many case examples from across healthcare primarily of where these working conditions are being created. And there are many all over the UK, particularly in Wales, that we can draw on to guide us in how we create these compassionate and effective cultures. How are you doing? You with me? Yeah? And I just want to mention this because I just want to really be clear, this is not some management ideology I'm presenting you with. This is evidence-based practice. So in England, when we introduced the National Staff Survey in the Health Service in 2003, that was the first time there'd been a national survey. There's one in Wales in healthcare. I don't think there's anything in social care yet, is there, Catherine? No. We introduced it in 2003. There are 500,000 people respond to it every year in England. Over, 16 years now? And what we find is that if we want to predict the performance of healthcare organisations from all of the data that's gathered in England, and boy, is some data gathered, nothing comes close as staff experience as a predictor of care quality, financial performance, patient satisfaction, staff well-being. So when staff say that they have high work pressure, patients say that they're not treated with dignity, they don't have respectful interactions, they're not given the privacy they want. When staff report poor health and well-being, subsequently, a year down the line, 2 years down the line, we see those organisations have significantly worse care quality as rated by the Audit Commission, significantly worse financial performance, significantly lower levels of patient satisfaction, and in the acute sector, significantly higher levels of patient mortality. So staff experience is fundamental to our ability to deliver in our work organisations, and understanding their motivations and needs and meeting those needs for autonomy and control and belonging and competence is fundamental. That's how we'll achieve what we need to achieve. And the fourth area of culture that I mentioned in terms of these 5 areas is the importance of innovation and learning and quality improvement. And again, when we reviewed all of the literature, and all of the reviews I'm mentioning are embedded in the presentation with links that you can use to download them. What comes out as core to creating the conditions for transformation, for innovation, for learning is compassionate leadership. Because when we have leaders who listen, who understand, who empathize, and who help, that creates the conditions for what my colleague at Harvard, Amy Edmondson, calls psychological safety, or a fearless organization, where people feel safe to speak up about concerns, about errors they may have made, about having an unmanageable workload. And when people feel safe to speak about these things, then that's the beginning of the innovation process. And we won't achieve transformational innovation unless we create a climate of psychological safety. And I'll summarize what the key elements of psychological safety are. Is that my signal to get off, Sue? 10 minutes? And key also to creating the conditions for innovation is this issue of autonomy and control. And what we've come to conclude from all of the work we've done in health and social care is that creating collective leadership in our organizations is fundamental to our ability to deliver for communities. The people who work in health and social care are probably more motivated and skilled than any other area of industry. Particularly in healthcare, why would we manage them through command and control? So we have to move away from command and control to collective leadership. And what that means in practice is everybody feeling that they have leadership, authority, responsibility, they can take leadership action. And I think that applies not just to those who work within our organizations, but to patients and particularly to communities. It's everybody working in teams where there's shared leadership. So though Hugh may be the hierarchical leader of the team, when Catherine has the relevant task expertise for the task in hand, then the leadership seamlessly shifts. Leadership in teams is about facilitating everybody's input, not about controlling everybody. And it's interdependent leadership, leaders working together across boundaries, prioritizing care overall, not just their own areas of responsibility. That's what enables us to deliver for the people of Wales, not just within our organisations, but across organisations. And it's consistent approaches to leadership. So, it's no good if in one department we have a leader like Hannah, who is this warm leader, kind, caring. Where are you, Hannah? Compassionate, appreciative, yeah.
Didn't say that about me.
And then in the next department, you've got this dictatorial, despotic tyrant. We have to have consistent approaches to leadership, characterized by authenticity and openness and humility and optimism and compassion and appreciation. Consistent approaches to leadership across the organization. And collective leadership, I think, is really about how we involve our communities in the genuine co-design of the services that we provide. We can't respond to the challenges we face as some kind of, in health and social care, as being paternalistic organizations that simply decide what services communities need. We've reached the end of that road. It's unsustainable. And staff are being damaged demonstrably in the process. And we've got examples in Wales where transformational approaches are being taken that involve the community and service users and citizens and those we care for. There are fantastic examples, internationally. The Nuka system in South Central Alaska, a very damaged population of people, high levels of drug abuse, of alcoholism, of suicide, and the whole community now takes ownership of health and care services. People are called citizen owners now of their services. And it's transformed outcomes in terms of drug abuse and alcoholism and suicide, or the Montefiore system in the Bronx, which has been developing over nearly 90 years now, where the community and all agencies work together to address the underlying problems that cause people to turn up at A&E with a drug overdose. And the example in Christchurch of where all of the agencies have worked together over a number of years with the community, and it enabled them to get through both the earthquake and through the horrible shooting in Christchurch. So we've got great examples of where this is happening, or the Wigan example of Healthy Wigan. So that's what I think collective leadership means. But also I think underpinning all of this is the importance of the fifth element, which is about teamworking and working effectively in teams, working effectively into team, and working effectively across organizational boundaries. And we've been doing this for 500,000 years, working in teams. We do it really well, but we're not doing it well in our modern organizations, where we are not encouraging the development of teams. And yet we know that when people work in teams, just simply with clear shared objectives, 5 or 6, and where they take the time to meet regularly, they're 50% less stressed. 50%. In the data we've gathered for doctors in Wales, it shows that they're 60% less likely to have musculoskeletal problems, 50% less likely to have been taking time off because of work-related stress, and 1.5 times less likely to be considering leaving the health service, just simply if they work in teams that meet regularly to review their performance. We know what effective team working looks like. It's kind of not difficult to do, as I said, because we've been doing it for many years. These are the kind of key elements of it. The challenge is to make it happen, and the challenge is to take the time to meet regularly. In all of our research in the last 30 years, we've found that teams that take time out on a regular basis for debriefs, for supervised practice, to have away days to review, are dramatically more productive and innovative than teams that don't. A recent meta-analysis combining the data from 49 separate published studies of teams taking time out to review found that on average, they are 38% more productive. So teams that take time out to review, that stop being desperate, being driven, being anxious, teams that take time out to review, this is 49 separate published peer-reviewed studies, are on average 38% more productive. So taking time out is not just a nice to have, it's kind of fundamental to our delivery of, for the people that we serve. Yeah, I'm going the wrong way. Make sense? So I went up about 3 years ago to one of the hospitals in the northwest of England that has been very effective in creating these kind of cultures, Wrightington, Wigan and Lee. And I attended their engagement committee meeting, and they kept talking about the horse. So I asked what's this about a horse? And then they told me the story of a patient, Sheila Marsh, who was sadly dying in the palliative care ward. And she had just hours left to live, and one of the staff asked her, what would make you happy right now? In your last hours, what would make you happy? And she said, well, I'd love to see Bronwyn. That would make me so happy to see Bronwyn, was the horse she'd raised over a 25-year period, because she worked at Haydock Park Racecourse. And the nurses got in a huddle, and they called the family, and they said, can you bring the horse to the hospital? So they brought the horse into the hospital, and they took Sheila Marsh out on her trolley into the car park. And the horse clearly recognized her and nuzzled her and kissed her, and she has the most beautiful smile on her face, really full of happiness and full of love. And it was a really important moment for her. Sadly, she died a few hours later. It was actually really important for her family, who were hugely appreciative of what the staff had done. And it was actually very affirming and moving for the staff as well. No one called infection control or health and safety, because there was a culture of compassion and engagement. Staff did the right thing, and they knew, because there was a culture of compassion and engagement, staff did the right thing, and they knew they would be supported. The eminent Don Berwick said recently in a webinar we did at the King's Fund, we should just have one rule book for staff in our health and care systems, with one rule: do what you know to be the right thing. Do what you know to be the right thing. So the challenge for us is how we create the conditions where staff will do the right thing and they know they'll be supported. I talked to one of the nurses back in November who was involved in this. She was at a meeting that I was at, and she said, oh, I was part of that group of nurses, and we were terrified when we did it. We'd get into so much trouble. But actually, the only trouble we got in was the chief exec was upset because no one had invited him to that moment. So, yeah. So I think what's really important also in terms of our understanding of how we deliver for the people of Wales is the importance of integrated health and care across all our organisations. What do we know about what enables that very difficult thing to work? I kind of think, you know, our belonging is it has two sides to it. As human beings, belonging is probably the most important quality we have. But also, on the other hand, it's the most dangerous, because what we do is we create groups that we're part of that give us a sense of identity. and we discriminate against, or we don't identify with, or we are negative to the groups we're not a part of. So belonging brings us together, but it also has this seditious side in a way that causes us not to be cooperative with people we see as being part of other groups. Do you know what I mean? Do you know what I'm saying? So what we know from all of the research is that there are kind of 5 things about building trust and building a sense of intergroup trust. And these are the 5 elements. We need to have a uniting shared vision. We're here to deliver for the people of Wales, to make Wales a model for the world of a happy community. We need to translate that into long-term objectives, not another bunch of 12-month objectives. It's about what are we going to do over the next 8 years to transform the experience for people that we serve, that we care for, that we support. Long-term objectives around looked after children, around people with dementia, around home care. What are those long-term objectives going to be? Because we need to have a sense we're in this for the long term. It's not just another short-term initiative of integrated working. We need to have frequent face-to-face contact with each other. We build trust, we build connection, we build a sense of belonging. We blur the boundaries between self and other through compassionate face-to-face interactions, through being present with each other. It's about managing conflicts in a creative, positive way. If we're trying to deliver for the people of Wales and integrate our ways of working, if we're not having conflicts, we're not doing anything. Conflict's an inevitable result of innovation. So we have to have a shared model of conflict management that focuses on managing conflict transparently, ethically, creatively, and welcoming conflict and moving towards it, identifying early and working with it early. And I think as a community of leaders, we must develop such an approach that enables us to innovate, to work together across boundaries. And it's always asking the question, every organization, every leader, always asking the question of other leaders, other organizations, how can we help you deliver for the people of Wales? Because that sense of mutual shared concern underpins the sense of belonging and trust amongst us human beings. Does that make sense? Those 5 principles, and we've developed, for all of these areas, we've developed measures that you can use. We've got a partnership assessment tool. And it's about, I want to finish by going back to this concept of psychological safety. Just to summarize what I've said, it's about, all of this is about creating safety for human beings. When we feel safe, we innovate, we're effective, we're creative. It's about shared vision and values and objectives, taking time out to be still, to reflect, to learn, frequent face-to-face contact, valuing difference. Diversity is beautiful. It's the nature of our existence. It's the nature of the universe. And we should be welcoming and exploring and valuing diversity and difference of opinion, of professional background, of organizations, of demographic backgrounds, and also valuing conflict as a means to advance psychological safety. You know, when we work through conflict, we feel safer with each other. And it's about that sense of humility and mutual support. And in the context of great compassion and team working, that leads to increased levels of trust and dramatically improved levels of innovation. But I want to finish by emphasizing the importance of interconnectedness. As I said earlier, the challenges that face us are so great that we will only succeed in facing them if we work together across boundaries. And I believe that's the key challenge for us as a species now. That's the key challenge for us as a species. The challenges we face are global. Unless we work together across boundaries, unless we come to see ourselves in a different way, not as warring, competitive, killing, but as a fundamentally cooperative, compassionate, supportive species. Unless we come to see ourselves in that way and operationalize that, we can't respond to the challenges that we face. And compassionate leadership is at the core of this. So if all of the people who work in health and social care in Wales come into work and encounter compassionate cultures, they take that back out into their families and their communities. That's probably 1 in 8, 1 in 9 of the workforce in Wales. And if all of the people who use health and social care services in Wales encounter compassionate cultures, they take that back out into their families and their communities. There is no more important set of institutions in our country than our health and care organisations for transforming the culture of our country at a time when we just desperately need it. But for you to have the capacity and the resilience to lead compassionately, then it begins with self-compassion. We have to pay attention to ourselves and understand the challenges we face in our work and in our lives, and care for ourselves. Care for this unique being, this unique manifestation of this mysterious universe, and then take intelligent action to help ourselves in order that we can be our best selves as leaders, as humans, and stay close to the core values that give our lives meaning, like compassion. And that enables us to have deeper and more authentic connections with all that we lead. So, diolch yn fawr. Diolch yn fawr iawn. Thank you.